I think that having a diagnosis of hEDS or HSD, I think one of the things that it really does, which is helpful, is it helps people know that they're not imagining things. I think that's the most
Yeah, I
important
agree.
thing. Hey, I'm Hypermobile, and if you're listening to this, I'm guessing you might be too. Hi, my name is Alex, and I'm your Hypermobile host, and today we have on the fabulous Hannah. Hannah, also known as the histamine queen on TikTok, and I think I helped you come up with that name.
You named me.
Thank you. Hannah's here today to interview me. So we have a guest, but also I'm the guest. So this is kind of like a meta episode. And this is episode 1 of the season, and it's being filmed a little bit later than the other episodes for any of you listening. So we've kind of had the chance to go through now and see what's really coming up and what's really important and like kind of the why about all this. But before I start to micromanage everything in my episode, I'm going to take my hands off the wheel and let you go. Hannah, take it away.
I feel the weight of the responsibility. So, Alex, I'm in charge today.
Okay.
So, we're going to ask you a few questions, and I've enlarged the text.
Yep.
Because my grandma ways, I continue. I've got baby face and grandma hands in true hEDS fashion.
That is the life. Did I ever tell you my mom was the director of a retirement home for marketing department purposes? And when I was age 12, I was like going to bathrooms, looking at grab bars, just like, wow, this accessibility stuff is so nice. So we are all old on the inside, but young on the outside.
Definitely. Yeah, grandma at heart. So, Alex, should I call you Alexandra?
I think Alex, because that's what, I don't know, that's what everyone calls me online, but...
I've got some questions prepared from you today.
They were collaborative, though. We did talk about
We
them.
did. But I would like to know,
yeah,
why have you been so quiet on social media lately?
Oh, getting to the heart of the matter. The last year's been rough times, to be entirely honest. So, to start off with, I got my hEDS diagnosis, so I now officially have hypermobile Ehlers-Danlos syndrome. And people are always like, is that a good thing or a bad thing? It's kind of just like a thing. Like, it's just, I've known for a long time, obviously with my work with patients, I knew that I met the diagnostic criteria. And there are some reasons that it kind of became time for me to really prioritize pursuing that. As you know, in the UK, you usually have to self-fund these things.
Yeah.
So I was like, I want to renovate the kitchen, but also like...
Not fall apart.
I know. So I want to not fall apart. So over the last year, just a few things have made that more of a priority. So going back to things like the last year, I've just been really tired, in part because of the realities of living with a condition like hEDS or HSD. But also I decided to do things like write this book.
Yeah.
So as you know, the book is my passion project. It's called Help, I'm Hypermobile, like the podcast, your how-to guide for hEDS, HSD, and life in a hypermobile body.
Yeah.
And I had this idea that it would be so simple to write a good nonfiction book, because I want this book to be like a survival guide almost. I want it to be something that people can refer to, that's mildly entertaining, relatively useful, and that is properly referenced so that things are actually factual. And that is not easy.
No.
So we're in the final process now of copy editing and getting all of that done, book formatting and so on. I wanted the book out on January 1st. That's not going to happen. It's been pushed back to what's looking like a March publication date. But yeah, that has been where I've been hiding. And you very graciously let me stay with you in Whitby and lock myself in your attic.
The attic. That's where most artists do their best work, is in the attic.
And the view of Whitby Abbey was very inspiring. And you saw me, like you would come up and I'd be on the bed, like hunched over typing until my fingers, like they would get cold and painful, to be honest. But nothing is gonna stop this book from happening. No. So you know how you've seen it firsthand.
Yeah, and I've seen you cross-legged on my bed, which I was very impressed at. Yeah, I used to sit cross-legged until the knees gave up.
Yeah, it's hard to find a position. The truth is, every position hurts you eventually. So you'll see me fidget, like during these episodes, I literally swap how I'm sitting cross-legged to try to not wear out or overly stress one side or the other. My bad writing position or studying position was always lying on my front. I would do it on my elbows, like writing or typing. I think that's what really irritated my neck growing up, especially being a student. But yeah, do you remember I'd go to the library too, the Whitby Library, and put my compression leggings on?
Yeah.
Because sitting with legs down, that hurts as well. And I would just write there and you'd be like, when are you coming back? And I'm like, 2 more hours.
What would you like for dinner?
Basically. So that's one place I've been. Last year, I was also diagnosed with cervical intraepithelial neoplasia, which sounds really scary.
It does.
If I did not work in the healthcare field, I would have been freaking out more than I did.
Yeah.
But it basically meant that I had precancerous cells in my cervix, which for me, because of what happened to my mom, which we'll get to in a little bit, is really upsetting. I think, I can't remember if I called you ugly crying, but I was like very upset by this because when you go for your pap smear, they find you have abnormal cells. You then need to go for an assessment, a colposcopy and a biopsy. So when you hear scope, that means camera. So they take a little look at it, see what's going on. And then the biopsy is they take the tissue.
Yeah.
And that was a whole stressful, upsetting experience.
Yeah.
I'm all good now, so nobody needs to worry. But that kind of did really take up my whole summer last year, just in terms of the stress and anxiety that I felt about that.
Well, I mean, as I say, we'll talk about your mum's story later, but I can understand it. It scratches on a wound that's very close to the surface, even if it's not. You understand it's not the end of the world, hopefully.
Yeah,
but it's end of the world right then. Definitely.
It's this weird mix. Like, I hate being a patient, and I actually am really nervous for today because I like to be in control.
Yeah,
I like to be the one in charge. It's really weird not being in charge in situations. But yeah, it's like I was looking at the research, knowing that I'm not in immediate, peril necessarily, but this gut visceral reaction people get sometimes to certain health issues, it gets to you. Like, I was up till like 2 a.m. just sobbing, especially before the procedure. I do have to say as well, too, for anyone listening to this, I am on TikTok, I'm on social media, and there are a lot of people talking about their experiences on there, as they, are absolutely entitled to.
Yeah.
I learned so much from just hearing from patients.
Yeah.
Like things about changing different ports and all types of medical things that people have to manage that I would never know about. Like, I just learn through seeing what people actually experience. But I have to say, some of the content really, it did make me a bit more stressed because people were talking about how painful it is having the biopsy done. I have to say, for me, I don't know what's wrong with my cervix. Maybe I don't have any nerves in it. I don't know. It was okay. It was not like as bad as I thought it was going to be in terms of pain. Given that we're in the UK and they don't tend to do any pain management stuff, I had nothing. If I was managing the procedure myself, if I could choose what to have, like, I wish that they'd just given me like a mild sedative the day before or something.
They do it in different countries.
Yeah, because the anxiety was bad. Exactly. The thought of the whole process is like terrifying. And I forgot to do medical disclaimer again. We'll put it in the text. This is not medical advice. I don't even know what we're going to talk about this episode, so I'm just going to put a disclaimer on everything.
Yes.
There might be swear words, there might not be. We're just going to wait and see. But yeah, this is not medical advice, and listen if it's appropriate for you to listen.
As I always say, I am just some chump on the internet.
Yep.
I just go on my merry way and go, that looks interesting, that makes sense, and then.
Well, I call you, you're an expert patient, or
fountain of knowledge. Some
you have some lived experience, and we'll be interviewing you for later in the season as well, which I'm so excited about. But yeah, that happened. So that health issue happened. My gut issues. So as you know, I manage my muscle and joint issues really well, given that it's my work, luckily. But gastrointestinal issues for hEDS are not fun.
Chaos.
I have not cracked the code.
No, no.
So,
but there is no code to crack, apparently.
There has to be a code.
Just changes.
There must be a code somewhere. Okay? I have not cracked that yet. And that is something I get a bit embarrassed talking about it. I do actually talk in one of the episodes, the guest I had on, a patient, we had pre-episode talk, and I was like, do you want to talk about gastro issues or not?
How far do you want to go?
We went far. We did talk about the time that I did not use the toilet for 3 weeks, which was like humiliating as a 15-year-old and confusing, and like it all makes sense later, but you can look well and have really problematic things happening on the inside.
Absolutely.
Speaking of which, take it away.
All right. So, Alexandra.
Ooh.
How would you explain hEDS to somebody who hasn't got a clue? Because I had this question earlier when I went to visit my auntie, and another of my relatives was recently diagnosed with hEDS,
Ooh.
which is cool because I played a part in her diagnosis, hopefully. I know, so small clap. And my auntie said, well, how do you diagnose someone with hEDS? Like, what's the deal? And
Well, there is a whole chapter in the book
And
on
I-
this.
and I said, where do you want me to start?
Absolutely. So you saw me with the book writing, you saw me be happy some days and really sad and
Yes.
angry other days. The diagnosis chapter
Yeah.
was a stressful and frustrating chapter to write for sure. So for the full depth answer, read that when it comes out. But
Refer to
here's the short answer. There's kind of two approaches you can take with this question, right? From a medical perspective, we have genetically inherited. So we know it's inherited.
Yeah.
We know it's autosomal dominant. So if a person who's affected has a child with someone who's not affected, there's a 50% chance that any child is going to present with hEDS or HSD. We also know that it's a connective tissue disorder,
Yeah.
and we know that connective tissue is in every system in the body, which is wild and
Yeah.
partly why it gets so disorienting. So we can say all these medical things, but I think it helps sometimes to think of it more in a different way in terms of making it make sense to patients or make sense to people where we're not talking in a medical context, like
Yeah.
your grandma or your aunt or whatever, like they're not a doctor, right? So when I'm trying to explain it to family, I'll say things when I'm talking to patients who are trying to start to understand it. I'll say things like what I said in an early video. So one of my first viral TikTok videos, I'm wearing a green t-shirt and I talk about my shoulder being homeless.
Yeah.
I don't know if you ever
I
saw
remember
that.
that. I don't know when I saw it, but yeah, I've heard you say that a lot.
Yeah, it's like this feeling out
Yeah.
of place. So if I'm trying to describe what it actually feels like to someone, I would say that having hEDS or HSD, it feels like everything is kind of not quite where
Not
it should
quite
be
right.
all the time, or not quite working all the time, which is really difficult because when you look in the mirror, you might look fine. You
Yeah.
might even look great, right? Or you might also not look great, and that's okay too. But it's like it's the outside sometimes does not match the inside. We have that invisible illness or invisible
Yeah.
disability component. Another analogy I like to use is I think of it like an old Victorian house. So I didn't get this till I moved to the UK. I've
Yeah.
lived here for 12 years now. But these old Victorian homes, there's like if you buy one, and be careful if you do, but there is stuff.
Yeah.
Yeah.
I live in, it's predates Victorian
It's so
times,
cute.
but I feel it. It
Yeah.
falls apart, but it looks fantastic.
Yeah,
Yeah.
it has charm.
It does.
We have
Crooked charm.
what's the word from Better Late Than Single? The phrase unexpected charm.
Unexpected charm.
And the pillow is unexpected. Better Late Than Single style pillow, by the way. But yeah, unexpected charm. So the person with HEDS or HSD, like, look, they can look
Yeah.
a certain way, but on the inside, sometimes things are not quite as they should be. So going back to that house analogy, there's probably some electrical issue, and when you fix that,
Yeah.
there's some plumbing issue, and when you renovate the kitchen, you need to go renovate the bathroom. So to use myself as an example, it's like I had to think of dealing with PCOS early on, which again is, I'm not saying it's the same as HEDS. It's another condition. I believe, and I always mix this up, I think it ends up being classified as a co-occurring condition based on research. But please check the book. That's where everything is
Yeah.
referenced and cited appropriately. But it's like, you'll deal with one health issue and then you have another. So maybe you have MCAS or some issue like that, and then you'll deal with that, and then another thing crops up. So it's always this like kind of firefighting that never
I always
ends.
talk about it like the house is on fire, but
Yeah.
it's like 16 different rooms.
Yep. And if you try and fix every room at once, you have no place to live. So I
Yes.
talk to patients
Yeah.
like when they're like, Alex, should I see the cardiologist, gastroenterologist,
Yeah.
respirologist, whatever? I'm like, you can,
Yeah.
but it might
Yeah.
be better to take it one step at a time.
Yeah.
If we're trying to manage this in a slow and sustainable way,
Yeah.
and also figure out what helps and what doesn't, because people
Yeah.
will try and do everything, and we don't really know then what's actually made a difference
That's
to their
true.
symptoms and what hasn't.
It's the strategy of it all is it's incredibly daunting.
Yeah.
So then you kind of scale back and you go back to basics, and then you realize, well, I can't put one room out because the other 16 are raging.
Yeah.
but then you've got to kind of dampen down them all a little bit so they don't spread to the next room.
Yeah.
And it's the strategy that I think is missing a lot, that I've as a patient I've struggled with.
Yeah.
Because you go to one specialist and they say one thing and they go, right, this is 10 out of 10 what you've got to do. So you do that, then that affects that thing, and then but you're not addressing that thing, and then well that undermines that, and it's just like, oh.
And this is why we need medical doctors who will help with more of the coordination of care and management, because patients ask me this, and again, I will give answers within the scope of my professional expertise. So for anyone who doesn't know this yet, I'm still not a medical doctor, believe it or not. No, just
when
kidding.
will you take one for the team?
You know, I like people tell me like, don't like, I have a nice job.
I think you would lose your mind.
I get to sleep at night. Like I don't have to, I don't have to deal with certain bodily fluids. I love my work. Okay.
It's true.
It's like, we need people who look at patients and help them kind of coordinate care and almost triage. Because patients, even from a musculoskeletal perspective, they'll come to me and say, Alex, my shoulder hurts, my knee hurts, my hip hurts, my neck hurts. Where do I start? And it is within my scope to say, okay, let's focus on this, or let's get some medical imaging to kind of figure out what we need to prioritize and how. So going back to what you said about strategy, it's paramount.
Yeah.
And I honestly, a thought that I do have often is like, I don't know how people cope when this is not their job or their obsession. I don't know if we can say that about me, but it's like, I think about this
benevolent obsession.
Yes, it is. Dave is like, Alex, please, no work talk. Like when we have dates, there's a rule. I last like 2 minutes before it gets broken. But yeah, it's like, I don't know how people cope when they don't know anatomy, physiology, and they haven't studied this in detail. It must be, it's like living in a home and everything's breaking and you don't know what to do and the attic's haunted. It's like...
And then the instructions are in like Chinese.
Exactly.
And I don't speak Chinese.
Yeah, you're just like...
I've got no hope.
Yeah, 100%. But yeah, that's how I describe hEDS or HSD. It's like, it's a genetically inherited connective tissue disorder where we have a lot of different things happen all at once. Yeah. People can be affected in a variety of ways, and the hard thing is it's same but different. You know, right now there's a lot of heterogeneity. If we look at people with hEDS or HSD, some will be more affected, less affected, differently affected, or they'll be okay, but something will happen and then they'll be less okay. There's a lot of moving kind of parts. And that's why we see people, like me, who can go do all the gym or sporty things that I do and work like more than full-time hours, quite frankly. And we will see other people who also cannot work and who cannot go to the gym. So that's why we see the spectrum.
But I mean, even within your own story, you weren't able to perform at that level your entire life.
Oh, there were the dark times.
Yeah, exactly. It fluctuates from person to person, but within the person too.
The ups and the downs. I call it riding the ups and riding the downs. And when you have an up, I think it's critical that patients are supported in making as much progress as they can. So when I have a patient who they're feeling okay, they're ready to go, I'm just like, let's go and make sure to not make mistakes. Let's make sure we get progress, but let's take advantage of this energy that you have or this time or this kind of improved management of symptoms. Let's make hay while the sun shines, knowing that there will be at some point a down again. One day, I think I told you when this happened. So fiber has been a very difficult thing. Again, I don't know what the answer is on fiber. Don't ask me. We need a nutritionist on here or something. But I took fiber for a few years. It helped. Then something bad happened. I stopped taking it, got into the whole FODMAPs thing, low fiber, blah, blah, blah. Got back on the fiber, on the psyllium husks in my case. And then, well,
the cursed Weetabix.
I know, but we're all different. We're all different. And two psyllium husk fibers was working great. But then I was like, if 2 is good, 3 could be better. No. Yeah. 3 was worse. Okay. So it's like, and again, you would think that's just a small thing. Oh, I took 1 too many, psyllium husk capsules. I was wrecked. I almost had to cancel clinic that day. I was like out of it for a week. So it's like these little things can have big consequences.
Tipping balances are so much more.
It's like a knife edge. I think you came to the workshop this summer, and I had this graphic of someone like walking a tightrope and then alligators in like a canyon below. It was a very artistic and beautiful.
I was impressed with your artistry.
Thank you. I'm good on Canva. But that's what it feels like when you have hEDS or HSD, you're walking this tightrope and it's so narrow. And even though like, yes, you can, walk fine when you're on it, one small step the wrong way and the consequences are way worse for you than someone who doesn't have, this condition or something similar.
I definitely co-sign that. It's difficult to explain sometimes when you say yes, but I always say about, I'm always calculating everything. Well, if I take one psyllium husk too much, that means Thursday, Friday are out because disaster happens.
Yep.
So I better only eat this, and then because for somebody else who doesn't have the same issues that I have, one psyllium husk is not going to be an issue.
Yeah, they'll be fine. They've taken one capsule too many. That shouldn't be like a huge, like, my week is ruined thing to do.
Exactly. Yeah, exactly. So. It's the my week is ruined type of aspect that is difficult.
Yeah.
But yeah, I think it's useful to get some knowledge around how hEDS works, because my childhood made more sense. Even though I wasn't particularly affected, it does help to know kind of more of the picture. What was yours like? Did you have issues?
Yeah, so for me, I had growing pains. My earliest memory is crying, like sobbing, because my knees would ache, and they would ache and ache. And I wish my mom was alive and I could have her on so we could talk about this, but like they would ache terribly. The pain was agonizing. Like if I was teleported back to wake up in Alex's child body, I'd be like, shoot, I don't want to go to sleep tonight. Do you know, I'd be
not doing
fear of the pain.
Yeah.
Okay. And she would tickle them and joke about amputating them, not to be like bad or mean, because, you know, children, they have weird sense of humor. And I thought it was hilarious that my mom was like tickling my knees, like, we can take them off if they're causing problems. But for me, you know, as an adult, thinking back about my earliest memories being pain, that's kind of like dark. Like
it is.
That is, my earliest memory should be something, you know, happy or nice. It shouldn't be pain. And I think that does affect you throughout your life in different ways, certainly. So lots of pain. I had other issues. So I actually, I don't know about the details on this. Again, my mom's not here, but basically my airway was quite occluded when I was sleeping. So my tonsils were so big, I had to have an emergency tonsillectomy. And again, I know that tonsil removal, like sometimes people think it's overdone or whatever, but in my case, it was bad enough. Like my mom would notice I'd stop breathing at night. So I had to go in immediately. And we do see these airway issues. We'll talk about it more probably in your episode. Yeah. But there was something not right with my airway.
Yeah.
I then grew up and I was just trying to be a normal kid. But when you look at photos, I'm covered in bruises. Like, I don't know how people were not, you know, concerned for myself. But I know why, because my mom also grew up covered in bruises, and my grandma, because it's a genetic condition.
Yeah.
But yeah, I was covered in bruises, and I would really struggle with a lot of gut issues as well. So my tummy would hurt. And I was one of those children diagnosed with IBS and gastroesophageal reflux disease age like 10.
Yeah.
That's not right. Like, kids who are getting diagnosed with these things, they need to be
suspicious.
I never saw a gastroenterologist. I never saw anyone.
And it's just, it's staggering that you didn't see a specialist at that age to be developing that type of thing.
Yep. And it gets worse.
Yeah.
So I've also fractured like 5 bones. It was an 11-month span. In September, I took a step. I literally just stepped behind me playing football. I just took a step. That was all I did. So a non-traumatic onset. And I fractured my growth plate in my right ankle and my fibula. I then, and that made that bone not grow as long, which will be relevant in a minute. I then fractured my growth plate in my wrist, and I chipped a piece off another bone. And that happened in February. So 3 months apart, I was having 2 pretty serious fractures. My right arm also didn't grow as long. Really? So when I hang off bars, we're always trying to find ways to kind of adjust. With shoulders, it's easier because of the joint to compensate versus legs where it's harder if you have a short leg. And then I also I fractured my a bone on the outside of my foot again. But I fractured 5 bones in a 9-month span. Why was I not referred to someone for a potential bone density issue or something going on?
Yeah.
So again, no medical care there. And then we get to the like kind of teens to wrap this up. I had that episode where I could not use the toilet for 3 weeks, and to not be referred for any care then, and to not even know how serious that was.
I know.
I was just like 14, 15, living my best life. It was summer. I remember talking with my close friends being like, what's the longest, like, you know, trying asking my friend Erin, I'm like, what's the longest time you've ever not used the toilet for? You know, trying to do some child research, basically. Like the internet, we had like Ask Jeeves or something. We didn't have Chat GPT. I was just trying to survive.
I know.
But then to not be referred for any care again was quite bad. And I had my jaw surgery. So my jaw was born in a way that was really problematic in terms of function. I couldn't eat a sandwich. I couldn't eat an apple. I would use my front teeth to hook chunks of the apple out like this and then go, like a little beaver almost. For those of you listening, you can watch the video and see a nice reenactment. But yeah, I would be like hooking pieces of apple out because I couldn't bite.
Yeah.
And my whole life, I just wanted to like eat a sandwich and not have the filling fall out because it's really depressing. You can't do that.
It's not ideal.
Yeah, and I had jaw pain and so on. And when I'd go to the dentist, they'd always use the child size retainer. And they were like, oh, it's so weird that you're like, you're getting older, but we still have to use the child size retainer. Yeah, because I have a narrow, high palate, which look at the hEDS criteria. It's there. Anyways, so I had all these things happen. I had what some people will call a double jaw surgery. That's kind of the common phrase you see online, where they broke my lower jaw, moved it forward, cut through my entire upper jaw, moved it up.
Scary.
I did not realize how major that was at the time.
It's just as well. I sometimes I think of I'm glad I didn't know some things.
Yeah, I know. I'm so pro informed consent.
Yeah.
But also, if I had given, and also
know.
they had to get my wisdom teeth were going sideways. They had to I think they used a chisel, but that was like a 6-hour operation, major. I'm happy I had it.
Yeah.
And I would do it again. And I'm going to explain why I hesitate to say that a little bit. But if I'd actually given informed consent, I don't know if I could have done it. So it's like, I think I still would have done it, but it's not easy. It's not, none of this is easy. And again, I'm not saying that necessarily, the procedure I had or the specific jaw presentation I had is linked to hEDS. I don't know if there's clear research on that yet, but we do know that having a high narrow palate certainly is linked to hEDS as per the current diagnostic criteria, at least. So I had that jaw surgery. And again, that's fine. Like that was managed. But 5 years after that, I had an infection in my bone.
Yeah.
And it's very rare that this happens. It's like something like 1 in 2 million. But basically at the time of the operation, probably a tiny bit of bacteria got under one of the screws or something. Again, I'm not an expert here. This is my understanding, okay? And over time, that infection was kind of developing, but my body encapsulated it. So it was kind of contained. But 5 years later, my body's ability to cope with that stopped, and I developed pain. And I remember I was up all night. I was like 20 at the time, and it just wouldn't stop hurting, and it got worse and worse and worse. And it was profoundly tender. And I was taken to the dentist. He said, Alex, you're always anxious. It's from grinding your teeth, this type of dismissive thing. I then deteriorated. I had a fever of 40 degrees. I was being sick like every half hour.
It's dangerous, isn't it?
Yep.
You don't realize how dangerous it is until you gain some understanding later. You're like, I was so close.
Oh, dude, I didn't realize till years after this. So it gets worse because then my mom takes me to A&E. She has triple negative breast cancer at the time. Her cancer's terminal. She's not well. And they essentially tell me I'm a drug seeker and to go away.
I cannot get over this. I genuinely.
I know. I wish I had gotten my medical files at the time. I didn't, and they destroy them, I think, after 7 years in Canada. So I don't even think I could access these anymore. But it's shocking that I'm there as a 20-year-old being like, hi, I had jaw surgery like 4 or 5 years ago. I have metal in my jaw. Could this be related?
It's bizarre.
Yeah. And I couldn't walk. I was literally having febrile convulsions, and it was only years later when I did my osteopathy degree and learned about bone infections and how close my brain is to this. And I was like, oh shoot, that could have gone really badly. So I am someone, and again, we don't know if there's an increased rate of this type of post-operative infection in someone with hEDS. I don't want people coming away from this thinking that that's necessarily the case. But I just became so used to being told it was in my head. I was told as a child, I'm too sensitive. I'm a prima donna. I'm drama queen, all these things. That it got to the point where I was just like, well, guess this is just my body being my body. And I just gave up.
And I think you also, if you don't have an ego that's out of control, you do take that on. You think, oh, well, I must be over the top. I must be a nervous person.
It's a reasonable thing to do.
It's reasonable. If everyone's telling you that, you take that internally, you go, oh, I must be acting a bit over the top at the moment. I'll just,
Especially when you're a young person, and it's the people in positions of authority like your parents and healthcare providers who are reassuring you and telling you, we've done these tests or they've assessed you in some way. Like you go to the hospital to be safe, and to think that you could be treated in a way that makes you not safe is wild. On top of all that, which I forgot to mention, the dark time. So yeah, all that stuff was traumatic, but like honestly, the worst thing I've probably been to.
Yeah. And this is how absurd it is. You know, that stuff, I mean, I nearly died. I did so much of stuff. Like, this is what really annoyed me.
Yep. What really, really was bad. So my mom was diagnosed with triple negative breast cancer when I was about. She always kept getting diagnosed, or it became metastatic or whatever, like on my birthday or around that. I don't like my birthday. January sucks. But anyways, basically, I was like 17, turning 18 or somewhere in there. She was diagnosed with triple negative breast cancer, stage 3B, which I think they should just call it stage 4. But anyways, and then I started to have worsening health symptoms. Now, whether this was related to dealing with stress from my mom's health, or if this was, you know, something else with me, just aging or the stress of being a student, who can say? I think when I look at patients, we're sensitive beings. Everything affects us to some extent. Am I going to feel pain more because my mom, who I love, is dying? Of course I am. But is it going to make pain come from nowhere?
Yes.
No.
True.
It doesn't, like, you know, and maybe there will be some study out there which shows like, oh, blah, blah, blah. There will be some study that'll disagree with me, but like, I've never had a de novo health issue, like out of the blue, that I could solely attribute to stress personally.
That's a good point.
But I had some headaches and neck pain at the time. I'd always had that heavy head sensation. In school, I would never sit upright. So I'd lie down on my desk like this, or I'd go like this.
I used to sit like this.
Yeah. I would do my binder. I'd always have a soft binder so I could use it as a pillow. You know, the fabric ones that Zifta?
So smart.
Exactly. But yeah, I was going through all this, and my neck pain would get worse and worse and worse. And I'd had horrific shoulder pain as well, which I've talked about on social media. But it was that coat hanger syndrome, what they call it, basically. And there was a point where it started to progress into these headaches. And the headaches I would describe as 9 out of 10. I hate numbers, you know that. But like, it was a very bad pain. It was honestly awful. I would rate it up there almost with how I felt when I woke up from my jaw surgery, which is quite high given that my whole face had been taken apart.
How old are you at this point?
21 with the headache. So kind of jaw surgery was 16, and then headache onset was like late teens, early 20s to kind of mid 20-ish. But the headaches I remember the first time it happened, I just came home and went straight downstairs. I lay in a dark room with a pillow on my face, just couldn't watch anything, couldn't listen to anything.
And you remember the first time?
Yeah, I remember.
So it was that sudden onset.
Yeah, 100%. The first time I had it. Honestly, given the fact I'd never had headaches and that was the worst headache in my life, I probably should have gone to hospital.
And that's the problem when you're constantly told that you're overreacting things. You don't act appropriately sometimes.
Yeah, I've never thought about that before, but I'm really lucky that headache wasn't something serious, because I never had headaches as a child and I never had headaches in my early teens. But I had these headaches start almost out of nowhere, you know, and probably they had been building up gradually, but I probably just blocked them out until it became too much. And it would feel like my eye was being strangled, my jaw, I'd have horrific tooth pain. It's a trigeminal neuralgia probably, right? And I have not had an official diagnosis of this, but I can tell you that I would get the tooth and jaw pain, which terrified me, having had a bone infection as well. So I'm very sensitive to that type of pain. But yeah, those headaches started, and they really, if I was ever disabled, you know, at a point in my life where I truly could not have worked, had no quality of life, and was really struggling, it was those the neck pain and headaches, because I couldn't leave the house. And I just, even like doing anything other than lying in bed in a dark room with a pillow on my face, like things like eating and using the toilet, like that was really, really difficult and honestly painful.
Life just stops.
Yeah.
And that's the problem, like, especially when life stops, you can't actually function to seek help sometimes.
Yeah.
So you need a support system.
It never even crossed my mind to talk
exactly.
to.
I know.
Also, I haven't mentioned this, and this is like a trauma dumping episode, so you all got warned with a disclaimer at the start. Okay. Basically, my mom had gone to the GP, like she interacted with her GP on 6 different occasions for a year and a half about the lump in her breast. And I saw her be routinely told it was anxiety, it was menopause symptoms, it was in her head. You know, people get lumps in their breasts all the time, don't worry. And it wasn't a cyst or imaginary. It was basically almost stage 4 cancer. And when they found the tumor, it was 9 by 13 centimeters. And my mom and I, like, I'm not the most busty person. We shared bras. And that means like most of her breast was tumor, but at the point it was found. 9 by 13 centimeters.
That's very big.
It's big. So for that to be missed, you know, and for the specialist she saw to say, like, you know, these are people who were working in less developed countries, to be like, this, you know, you would have had better healthcare in other countries than Canada, was also really, you know, a wake up call for me at the time. But the normalization of just seeking help and not being listened to was so entrenched in me at that point that I'd kind of just like accepted this was my life and that I have to live with it.
So you think that if she'd have had that diagnosis of hEDS and gone to the doctors with those symptoms, do you think things could have been different?
I think that having a diagnosis of hEDS or HSD, I think one of the things that it really does, which is helpful, is it helps people know that they're not imagining things. I think that's the most important thing. And when it comes to the book, for example, like something I haven't talked about much on social media, but that's really important to me, is that I will always feel like my mom may be here today if she was better able to advocate for herself, and if she'd been better able to trust how she felt in her body.
Yes.
But because she had a lifetime of muscle and joint pain and gut issues and different things that she like coped. I don't even know how she coped with a lot of it, to be honest, but she just somehow she pushed through it, like many people do, like many people listening and watching this podcast just do.
Yeah.
What really upsets me is that like she got to that critical health issue where she needed to be able to listen to her body and to trust herself, and, you know, to really push for that second opinion or that medical imaging study or whatever. And instead of being able to do that, she did, you know, what I then went on to do in some health situations myself, which is to say, look, the doctor says it's fine. I've talked with them repeatedly. It must be fine. Like, and she, I just believe that she would have felt so, like her experience had been so validated, her life experience, by a diagnosis, or even if she couldn't access a diagnosis. And again, many people can't. You know the situation in the UK, we've talked about on other episodes. It's difficult to get a diagnosis. Yeah, even if she couldn't, knowing at least that there was a plausible rationale for her life, her symptoms.
Yeah.
So I do think, I wish I could, you know, almost run a simulation and see what would have happened if she was not told, oh, it's because you're anxious, it's because you're sensitive, it's in your head. Like if she'd been told, hey, you know, there are reasons why this is happening.
Definitely. It's very sad.
Yeah, I'll never know, but that is my personal passion. One of the guests on the podcast, she's like, why do you do this? Like, how do you make this viable? And I'm just like, that's a great question. But it's really, it's
burning.
It's so
Something
important.
burning.
100%. This is critical. And this type of health awareness and this type of information about HDS and HSD, it does save lives. And I will always feel that way.
It does. I think, you know, because I started my TikTok, and I am someone who's never even taken a selfie up until that point. I hate it. I hate it. And you know yourself, it is virtually impossible to get a picture of me.
I've taken some.
I'll dodge. And it came partially from a place of feeling that burning, and I don't want to say it's not a rage, but it's a quiet rage, and you have to turn it into something constructive, otherwise it just eats you up. So for me, I wanted to talk to other people and figure this out as well. But it was something therapeutic for me. And I think if I didn't even have the same family history that you've had with your mum dying. Understand.
We have these
percent of it.
No, you're entitled to your own experience. I think too, there's always this like comparison thing. We all do it because we live with other people, but like I remember my mom would be dying and I would be having the horrific pain I had. My friend would stub her toe or something, and like that sucks. Like just things are all allowed to be lousy in different ways. You know?
I agree.
Like, I totally get that. In terms of my personal experience, I want to get into that more with you. We will get into that more in your episode. I think we'll touch on the PCOS, because my whole journey started actually with addressing my PCOS. And an argument I had with my doctor about how I didn't meet the diagnostic criteria and I was too skinny, even though weight appears nowhere on the diagnostic criteria. But let's get into that more when I talk with you.
I know, and we can talk about how I had the opposite experience of my consultant saying, well, you have a very PCOS figure, and I said, great. But yeah, it's different but same.
Same but different. We'll get into that more. But if we fast forward like back up to the book and so on, I think For me, it's about like people being able to access a guide.
Yeah.
I don't know. I do know how I got to where I am today, and it's through a lot of trial and error, a lot of luck.
Yeah.
And I would literally spend Friday nights in my 20s just on PubMed reading research papers instead of being with my friends, which probably explains some of my social issues today. But that type of like, it's just that sheer that sheer times amount of time spent doing this kind of trial and error approach.
Yeah.
That helped me a lot. With the muscle and joint pain, I was lucky again because I'd had some physiotherapy, manual therapy in my teens. It didn't do anything. It actually made my symptoms worse.
Yeah.
The exercises I was given made my symptoms worse, and I was blamed for doing them wrong as well, which really annoys me. So I had a very negative experience there, and it's only through luck that I was able to actually give manual therapy and exercise a second chance. But a lot of my 20s was just kind of spent doing this trial and error, kind of becoming, I think eventually I became the healthcare provider I needed.
Yeah. Yeah. And I think things would have been a bit different if you had access to a book where it laid it out a little bit more.
Oh, just absolutely. Just a little explanation, a little map, a few answers to questions I was dying to probably know the answer to. Like, so to give you an idea of the structure of the book, the first few chapters, we talk about diagnosis, we talk about relevant anatomy and physiology in a fun and accessible way.
Yeah.
Because I hate boring. You know that.
Yeah.
And but I also love science, and I think that this is really this knowledge is important because it empowers patients to ask questions. So when that patient is talking with their physiotherapist or their osteopath or whatever, talking with their medical doctor, they can say, okay, you're saying this, but what about this? It gives them that voice that I wish more people had, and I wish that I'd had, and I wish that my mom had. But as well, the second half of the book is an FAQ. So I get asked the most random questions on social media.
I was just going to ask you, is that why you wrote the book? Because you were getting random questions?
Well, it's because I always give the same answers. And that's something I'm quite proud of. Is I take a very principles-based and science-based approach. So I'm open. If I get something wrong, tell me. There are some things where probably I haven't said things perfectly. If people ever see content, you can tag me in it and I'll address it or whatever, right? But for the most part, I've gotten things, in my opinion, certainly right. And I haven't had to change my position much because we're looking at physiology and anatomy and some of the small amount of research that's done on this subject, which there isn't as much as there should be.
Yeah.
But on social media, I get asked so many questions like, what bra should I wear? Like, what type of exercise is good for hypermobility? Yeah.
Yeah.
Every question, honestly, home decor. Like, we've talked about careers in this field. I'm waiting for like a hypermobility interior designer. I have thoughts on everything from fashion to home decorating.
It affects everything.
Yeah. Oh my gosh. Like a pan I buy for my kitchen stove. Like I'm looking at the weight. How do the handles feel? Like,
does it feel okay?
The texture.
Is it a sensory nightmare?
It's easy to clean because I'm tired. Okay.
True. Yeah, that's very true.
So look, it's basically my brain in a book. And if you like my content, you will love my book. And if you don't, then please, you will not enjoy it.
No, I can tell that from the snippets that you've shown me. I thought this is a very Alex book. It's very much like, tell me what I need to know. Oh, there's a nice little drawing that she's done there. Oh, there's a chart. Okay, back to the science.
Yeah. It's useful information with fun little tangents in a cute little package.
But it was written in part in the town where Dracula is supposed to have landed. So I think you took some inspiration from that a little bit, just a little bit.
It was honestly
a little bit of chaos.
There were dark times, and the whole field is chaotic, quite frankly. Living with hEDS or HSD, going back to that first question at the start of this episode, what's it like?
Yeah, what's it like?
Chaos. Organized chaos. At best organized, at worst not organized. But yeah, we deal with it.
No, I feel that.
Any last question for today?
I would like to know so you talked about your childhood was difficult with pain and surgeries and fractured bones and just gut issues. Chaos. Yeah. And then you went through the dark times of the neck and head pain and jaw, all that jazz. How did you get from there to here? Because you said that you do quite well. You're at the CrossFit. The CrossFits.
Sorry about that.
How have you gone from there to here?
Slowly and carefully, I would say. So one thing that really helped me is that when I was going on my journey, social media was not a big thing.
Yeah.
So I had no money. And social media didn't exist. So I would go to a local gym by myself and I would just try and find a movement that I could do. Like I would be so happy when I'd find one random exercise that I could do.
Yeah.
And I would then do that exercise, and then I'd find another exercise. And it was just kind of this like collecting these almost these breadcrumbs. I was talking with a patient about this earlier this morning. When people try to do like, here's the protocol,
You see that a lot.
yeah, and it doesn't work because everyone's needs are different. So I was finding what worked for me. And by moving, I was building muscle mass. I was improving my other bodily systems and my health in general as much as I could. And because I didn't have pressure, oh, you should exercise this many times per week in this way. I went when I felt like it. I did not go when I couldn't, you know?
Yeah.
So it was just that little bit of consistently putting in effort. It is effort, 100%. Sorry about that. Yeah, putting in effort and giving it time. For me, it was like a 5-year journey.
It's a long experiment.
Yeah, literally kind of experimenting on myself. And be safe, of course. And ideally, if you can access a healthcare provider who can support you in this, in this area, that's fantastic. It will help you have progress faster. It will help you be safe. But if you're someone who's dealing with this on your own, I think that certainly finding exercises that make you feel safe. I'm always asking myself, do I feel safe when I do this? Does it feel good? Do I love it? If not, La Poubelle, like the La Poubelle guy on TikTok, he is my hero.
I love him.
We are putting so much stuff in La Poubelle, and exercises that hurt you or that you do not love. La Poubelle.
And that's so different from what a lot of us have gone through with physios and gyms where it's the push through culture. So it's interesting that you take the opposite approach sometimes.
My first question when I give a patient an exercise and they're not sure about it, I'm like, have I not explained it clearly enough? Is there something going on where the patient perhaps is not doing it well? But I'm looking first at me. I'm not blaming the patient and thinking, oh, they're weak. They need to stop complaining and work harder. I'm saying, has there been a communication mismatch here in some way? And sometimes, despite everything being perfect, I've explained it perfectly. The patient is listened carefully. They're doing it as correctly as possible. It's still not right. So there's a million ways to move. With one of the, I say good in a joking way, but one of the kind of good things with hEDS or HSD is there are different things you can work on. I could focus more on my gut issues, more on my strength issues, more on this, And even when it comes to CrossFit, I call it Alex Fit because like I don't do proper CrossFit. So I just like...
You're the problem child.
Exactly. But
don't worry about me. I'm going to do it this way.
I'm the weird one in the corner, just doing my own thing. So like finding an environment where you can embrace your weird, I think that is... If we're going to close on something for today, I think that is like a key thing is finding what works for you and being unapologetic about it.
Yeah. Definitely. I think that's where you need to have some knowledge of what's going on to have the confidence to go, no, I'm going to do it this way. This way feels right to me.
Yeah, absolutely. And whether that is something you develop over time, if you have the time or you go into this field maybe, or if you hire a professional and they're able to help you, that helps a lot. But yeah, it's becoming the person, becoming the expert of you almost and being able to help manage things in an active way, which is hard and tiring, and reading scientific research is difficult and making decisions is not easy, but none of this is easy.
No.
Anyways, on that mildly depressing note, we shall have to wrap up for today. I know there might be more questions. I think we should do this again someday.
I agree.
Maybe in New Zealand where you're moving. Who knows?
I mean, if you're gonna take a work trip anywhere and you see that.
We shall see.
First on the list.
Hannah, thank you so much for having me on.
Thank you for having me.
I can't wait to talk with you about some other things on your episode.
Yes.
Cool. Take care. Thank you again for joining us today, and I will see you for the rest of this episodes this season. It's going to be a blast.